a pharmacist clinical layer that runs on the pharmacy's own computer. Here's a lipid case, a patient already on treatment. Margaret is 58, with dyslipidemia, high blood pressure, and an underactive thyroid. She's already on a maximally tolerated regimen, rosuvastatin 40 mg plus ezetimibe. Her most recent LDL is 2.4, a number that can look close to target. But the hub back calculates her treatment-naive LDL at about 6.7, reproducing the UBC cardio risk method from her treated value and her medications. With a premature family history, her mother's heart attack at 59, her brother's stent at 62, that's a Dutch Lipid Clinic Network score of 6, probable familial hypercholesterolemia. And because her triglycerides are elevated, calculated LDL understates the risk, so the hub reads her goals against non-HDL cholesterol instead. Her non-HDL is 3.3, above target, and it recommends adding ApoB to the next lipid panel. On a maximally tolerated statin plus ezetimibe, and still above target, she meets the guideline criteria for a PCSK9 inhibitor. So, the recommendation is a PCSK9 inhibitor. Evolocumab, Repatha, is the first-line option, self-injected once every 2 weeks. Inclisiran, Leqvio, dosed just twice a year, is offered as an alternative that may improve long-term adherence. One click checks the whole record against the national guidelines and produces the finished set of documents. The clinical assessment leads with a clinical context summary, then the labs, non-HDL flagged above target, with the imputed treatment-naive LDL alongside. A prescriber facts, a brief clinical summary, and each recommendation tied to the guideline it's based on. A plain language take-home summary for the patient, with 2 key counseling points for each medication. And a pharmaceutical opinion, the documented drug therapy problem. Because this therapy meets prior authorization, the matching forms ride along, pre-filled. Here's the Canada Life authorization for Repatha. The hub ticked the objective criteria, like non-HDL above target, and left the familial hypercholesterolemia diagnosis for the prescriber to confirm. The Canada Life authorization for Leqvio, the siRNA alternative, filled from the same record. And the Novartis Leqvio Assist Enrollment, the manufacturer's patient support program, pre-filled with the labs and the familial hypercholesterolemia workup. A clinical layer that turns a pharmacy's own data into a complete, guideline-grounded lipid review, and the access paperwork to make it happen.